We're now going to look at cuts to the head. Now the first thing with a cut to the head is, has the person suffered any other type of head injury, concussion, things like that, skull fracture? So in this instance we're just looking at a cut, but even when you're treating a cut, always assume that there could be some that you haven't noticed, and maybe they are suffering from head injury, so look at signs and symptoms of head injury as well. So with cuts to the head, the key thing there is to make sure the wound is clean. You can then again put Haemostatic Agent on them no matter what size the cut is. If there's hair there, it's going to be more of a problem because the hair is going to get stuck in the cut, but that can be washed out later on at the hospital. That's not usually a problem. So once you've got the wound clear, maybe put hemostatic gauze on like WoundClot, and then bandage it. You can use any one of the types of bandage depending what it is. So if it's a big cut, you may want to use a trauma bandage, but standard first aid bandage is usually okay. Key thing is to be able to put it on and secure it. Try and avoid covering their ears because you don't really want to take away any senses, and particularly with a head injury, if you cover up both the ears, you may miss the sign of fluid coming out the ears if there was a head injury involved, a concussion, things like that. So we do need to be aware of what's going on there. So put it on the best you can. Smaller ones you can put a plaster or the gauze pad with micropore tape to hold it in place. But the key thing with head injuries is, yes, treat what you see, but just think about the whole time, could there be something more happening?